one of the other things that seems to have happened at big hospitals during the lockdown is that the number of heart patients coming in has gone down. And why is that happening? What we're also seeing is much cleaner air, much cleaner water. This is reducing asthma and allergy cases. And we spoke to some doctors. They said that not just our road, because obviously people are largely at home and therefore there are fewer road accidents, but even people who show up at emergencies for example, a heart ailment, that seems to have gone down. Now, why this is happening isn't fully researched just yet, but anecdotally, after having spoken to doctors who run some of the country's top hospitals, it seems to be a trend, with 50 to 60% reduction being reported in the number of emergency heart cases coming in.
A country of 1.3 billion grinds to a halt. India has shown dramatic improvement in its air and river waters since the start of the lockdown. But the jury is still out if the restrictions have signaled similar improvement in heart disease because of dramatic environmental changes. The country's top medical experts agree that the lockdown has reduced footfalls of heart patients to hospitals. But that shouldn't be seen as a sign of decline in heart conditions.
20% of the patients come from road traffic accidents or trauma. Now, as you know, the roads are empty, so that 20% is not there, and it's a good thing that they are not there. But we are still getting at least 60-70% of the patients are still coming. And in a hospital like ours, which is a super specialty, we get all the emergencies, heart attacks, the intestinal obstructions, the cancer patients, so and people who are in crisis with any other infection. So we get enough patients right now, but they are of a different variety, which is, say, if we were treating 150 patients a day in our emergency room, today it will be around 70-80.
A leading cardiologist, Dr. Sameer Gupta, feels most heart patients could just be taking local care or self-medication because of restrictions. Some others might be avoiding hospital visits for fears of catching coronavirus infection.
The number of patients with heart disease coming to the hospital has gone down in terms of number, for sure, when you compare it, over the last 10 days compared to what it was a year or 2 years ago. And if that is just because, and it's probably because of the lockdown, because it's difficult to commute, I think people are just scared of coming to the hospital. There's an inherent fear that, if I go out and I venture into a hospital, it's a place where sick people come. Can I catch the virus? Can I try and avoid going to the hospital for as long as possible? I'm not sure if the actual number of heart attacks have gone down that drastically as it is reflected in the number of patients who are actually showing up to the hospital.
Medical experts agree that a cleaner environment from the lockdown has provided temporary remedy to several other respiratory illnesses.
People with respiratory complaints and with cardiac problem are doing better, and their breathing is much more comfortable, and requirement of medication, especially inhalers in our patients with asthma and bronchitis, is down.
Hospitals such as AIIMS have launched special helplines to reach out to regular patients via teleconferencing, a step in the right direction there, as people suffering from non-communicable diseases might just need as much medical attention during these tough times. Bureau Report, India Today.
Now, those seem to be some of the positive side effects of this lockdown. So far, a lot of what doctors have been saying has focused on the impact the coronavirus has on your lungs. It cripples the lungs by attaching itself into the lungs. Now, there's more and more data emerging where doctors are treating patients, and they seem to be coming to the conclusion that the coronavirus is not just causing damage to the lungs, it's also seeming to cause long-term damage to the heart, apart from attacking the lungs. Now, this is a double whammy of sorts, because you would spend a lot of time thinking about the impact this could have on your lungs. Now, it turns out, according to new research, that it's also impacting a certain number of patients and causing long-term damage to the heart. Take a look at this report.
As coronavirus cases climb across the globe, so does the research on the disease's impact on the human heart. International health experts agree that COVID-19 may turn out to be a double-edged sword for the lungs and the heart in patients with severe symptoms. A leading cardiologist in Australia, Professor Bob Graham, however, explains that heart complications from COVID-19 develop only in a small percentage of patients.
We now know that a small percentage of people who get very severe COVID can get involvement of the heart, although in most cases the problem is the lungs and the heart suffers secondarily. However, there are some areas where heart disease or heart conditions and COVID really intersect very strongly.
Professor Jason Kovacic has authored a number of papers on heart and vascular disease. He explains COVID-19 in some cases may attack the heart muscle directly. Then there's the other way, a storm of immune cells that the body mobilizes to eradicate the virus that attacks the heart.
The virus can apparently directly infect the heart. So this is a condition called myocarditis. Only a small proportion of patients are actually ending up in the intensive care unit with this problem. The secondary effect, but what the virus appears to be doing, is causing such dramatic stimulation of our immune systems that this stimulation of the immune system is causing secondary effects on the heart, and the pump of the heart isn't working as effectively as it should.
Indian health experts also concur that COVID-19 can cause heart problems in some cases.
When there is a damage to the heart, when there is heart cries, it releases an enzyme called troponin. So it has been seen in many patients who have coronavirus infection. The troponin levels are high, and this is one of the indicators that we have a problem.
COVID-19 is a disease which which initially starts with a sore throat, fever, goes into the lungs, but also involves the heart. There are patients who come in with acute heart attack also, and also they could have cardiomyopathy. Nearly 35 to 40% of the patients would have a heart involvement.
As of now, supportive care is the treatment available for the small incidence of heart complications induced by COVID-19.
This could change the way hospitals and doctors needing to think about the patients with existing heart ailments. It could also open a second battlefront against the corona pandemic with new equipment and special precautions that doctors and hospitals would need to take for those patients who are either suffering from cardiac ailments or who are left with damaged hearts post-contracting the coronavirus. With Aishwarya Paliwal and Sanjay Sharma and Ajay Thakur, this is Milan Sharma for India Today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.